park, or where those truck
Hey, Dan,
parties, where the
whenever
bench
you're
park.
ready, we can.
They're
be ready.
usually they're like one behind the other, and I have to vote for those pickups.
Oh.
So I was like, well. if I
Before we
park
get started,
Sure.
sorry for just. Working now with Aileen.
Yep.
And he is going to be here with me tonight, tomorrow night, and then he's gonna take over doing minutes for these two committees.
Well, you've done an excellent job, may I ask. And hopefully, Max, you've got
Big shoes
Oh,
to
got
he-
big
fill,
shoes to
I
fill.
would assume.
He's way better at making coffee than I am, Tim. Bear that in mind.
Is that the only thing he has to do?
Now, Max, can you just give us a little rundown of you went to school,
Yeah.
Auburn High?
Yes, yeah. I graduated from Auburn High in 2014, went to the Auburn School District my whole life. Herman, then East Middle when it was still East at the time, then the high school. Then I did 2 years at CCC here in town, and then I transferred to SUNY Oswego. I got my bachelor's in public relations and minored in political science.
And your father's a great ball player.
He is allegedly, yeah, he.
So he says, right?
Yeah, so
Yeah,
he says, so he says.
says.
Yeah. But yeah, my dad's Steve Pinchak, my mom is Maria Pinchak. I don't know if
Pinchak.
anybody
Yeah.
knows them, but yeah, so.
Very well.
Just
Okay,
behind,
cool, cool.
just behind the
Walk
church.
the wire with Steve.
Okay, beautiful. Yeah, that's his scene down there.
My dad, your dad's from Fort Myers.
He is, yep, yep.
Elaine, he's here to keep me under
I was
control.
gonna say, whoa, I don't get voice.
So having said that, if everybody could just a reminder that it's really helpful, especially because you all have met Max and have only one person to remember. He's not going to remember all of you. Please make sure that you're saying your name when you're sending motions or
Yes, ma'am.
thank you.
Thank you, Max, for that rundown.
Yes, and thank you. Nice to meet you
I think
all.
your father beat Pinky every time he played him.
Are we ready? All right, I'd like to call the meeting to order tonight, Health and Human Services. If someone would be willing to make a motion to approve the minutes from July 12th.
Approve them, Mark, or make the motion, whatever it is.
Second. Trish Kerr, seconds. All right, any questions? All right, all in favor?
Aye.
Okay, great, thank you. What I'd like to do, we don't have a huge agenda, but I'd like to potentially get through the resolutions first, and then we can go on to the department reports or ask any questions related to the information that's here. So Kathleen, if you wouldn't mind, we could start with your 4 resolutions. And I looked, HH2 though is a grant, but it is new, so you might want to talk about that. But I think we can group together HH1, 2, and 3, and 4. You can discuss them, and then I'll ask for a motion for all of them, and then we can open it up for questions.
Thank you. You're correct that 1, 2, and 4 are really
The current,
recurring of funding that has helped us both in early intervention, public health emergency preparedness that we've had for a number of years, as well as our lead poisoning prevention grant. Some of these grants were delayed and being executed through the state. And so like lead is a catch up, but it's one that we'll make use of. And we have, almost all of them go toward a portion of salary for employees doing these functions, but then also some other materials. And HH2 is new. It's a good chunk of money that I don't know that we're necessarily going to make use of all of the money. But this is a new program that the State Department of Health has opportunity through some federal funding to create a public health fellowship. So essentially that was money that's put aside so that we can rebuild some of the infrastructure in public health departments. It will fund some bachelor's prepared people, and Cayuga County has been designated to receive funding for 1 graduate level person to work in public health. It would fund them for 2 years. I'd like to say the dates when this would take place precisely, but the state is actually doesn't have the contracts out yet. So they said, we need to have an agreement with you. We'll get the dates aligned. I don't know if they're working with semesters or what their dates will be. But they said 24 months of funding for these positions. It's certainly something we want to align ourselves to be able to take advantage of should that opportunity arise, should we have appropriate candidates to apply to work in Cayuga County. They are taking, state is starting to take applications for interested fellows on the State Department of Health website. And you have to apply through the state, not through the locality. So if you know of anyone you think may have interest in working in the field of public health, I would encourage them to make an application. And if they are particularly interested in working in Cayuga County, they can request for consideration for Cayuga County.
I got a question. Let's get a motion. Can I get a motion for HH 1, 2, 3, and 4? Okay. Anyone want to second them?
I'll second.
Okay. I guess my only, is there a requirement on what type of bachelor's degree that the person would have to have?
Great question, and I don't know that answer. They have to have an interest in public health, but that can, unlike at the graduate level, certain jobs require you to have certain degrees. So you could be an environmental health person, you could be a nurse, you could be a health educator, and health educators have a spectrum of bachelor's degrees that they can't go any level with if they're not specific to education. So there is some consideration. That's where I think part of the issue is too, that the state is finding it's not an automatic mesh with counties because of civil service. So whether it's contracted fellows, whether they're employees, and that's the style
To be worked out. You won't have to do the recruitment though. The state's recruiting and then referring.
The state is recruiting, but they are taking requests, and if we know people here that we said, you know, say if we had an intern who was fantastic, and we certainly have some great interns, we would encourage them to apply and request Cayuga County as their site.
And the goal is you train them and then hire them? I mean.
That would be the long-term goal, is to
Right.
have people for a couple of years, to orient them, see if, you know, they're beneficial to the departments, to help rebuild infrastructure, and then ideally, you know, if the county was in a position to hire on full-time staff, as after that fellowship funding is complete.
Sure.
Mark?
On HH2, it says word infrastructure.
Correct.
Can you
Personnel
expand?
infrastructure, though, it's personnel.
Just personnel.
It is, it's not like, we'll be able to buy a desk for them, but it's personnel.
Okay.
Building your team of people.
Yeah, correct.
Would you have authority on how to utilize these new fellows, or would the state be dictating that? How would it work?
It's, the local health departments get to identify, based on the applicants and the needs of the department, where to use them and how to use them.
Okay.
So that's good, we like that.
You're accepting all this money, and if you need to accept it, but the goal would be whether you'll spend it all, it's yet to be
Correct. We
determined.
would have to, in the first place, have them and then voucher for the funding.
Is this meant to be just a short-term 2-year program then, like just to rebuild the health?
That was very much the conversation that was had, yes.
One last question. These fellows that get hired, so let's just say we hire one. Now, is that term just for the 2 years, or is that, you know,
For the
permanent?
2 years of the funding, and then we'd have to come back here and say, gee, they worked out great, we'd like to hire them in a real long-term civil service position, but then we'd have to go through that process.
They'd have to go through the
With the
civil
county.
service. the whole-
Absolutely, and come back to all of you and request.
Thank you.
It's just, obviously they identify the need, they need to bring up more people with expertise in this area because there isn't a huge supply. at
I
this
can't
point.
even consider myself aging out, I'm far too young. But
Yeah.
when I realized that the history that I do have, I'm like, well, okay, yeah, we really need to get younger people in.
Chair,
Yes,
Oh,
Mr. Lynn.
we have a educational facility called Cayuga Community College, and I know Max just mentioned that he was at that institution for higher learning, and I was previously when it was ACC, when it was Auburn Community College, not dating myself. But is there any way that we can educate these people from the local so that we can fill these positions? take our own kids, educate them, and actually use them in our workforce
Using this funding or just in general?
in general for,
I mean, you used to have, I think, arrangements with the college to place nursing students here to do their, and, you know, to kind of meet their requirements
Public
for
health
school.
rotation. Correct, we still do that.
With the hope that, you know, the nurses, though, there's such a huge shortage of nurses now.
isn't,
Yeah. So, I mean, but you
Can't
do,
we
that would be the
expand?
goal.
We
You
Can't
would-
we
would
expand
love
that
to
program
have
to
local
full
people
seats?
apply, we would love to have local people apply because we're more likely again to stick around and who better to serve their own community, right?
but I mean, can some of this money be used to educate?
They have to be
Educated
qualified, they have
prior
to be
to-
qualified to apply in. And unfortunately, it can't go toward paid for tuition or a scholarship, not at this point in time.
Okay, just throwing that out.
Any other questions? All right, can, yep, yes.
I want to get through the agenda, but I'd love to have Kathleen come back on in regards to mask, no mask, or
I got a whole list of things
Yeah,
to talk
what,
about.
you know, what I'd like to do, because I think you do, Tricia has a commitment, so I'd like to get through the
Okay.
resolutions first. But then absolutely the departments can come back in and talk.
I mean, I drove all the way in from Boston. I'm
Right.
dedicated like you, Trish, to get things done. Let's go.
So all in favor for HH 1, 2, 3, 4?
Aye.
Okay, any opposed? Great. All right, ready? Hi. You want to talk about the
Christina. I just texted her about that.
She does not,
Okay.
So, HH 5 is authorizing the Director of Community Services to fill 3 full-time caseworker positions in child welfare of the Department of Social Services. So obviously you have 3 full-time
We have 3 vacancies.
vacancies. And I know there was discussion because in the can I get a motion for that? Filling 3 full-time budgeted caseworkers in the Department of Social Services. Okay, second? Mark, Tim, not me.
Awesome.
Okay, thank you. Obviously, these are full-time budgeted vacancies, but the authorization to fill talks about you actually have 5 vacancies at this point.
I think so, yeah.
And I don't know if this is something unique, if you're seeing more turnover.
We're seeing quite a bit of turnover there. It's a hard job. We're excited we got 25 applicants.
Oh, that's good.
Yeah.
That's, you haven't seen that in the past, the 20 some applicants. And that's to take the test?
We, it's like continuous recruiting. This is one of the titles that you can continuously recruit on. So when
Okay.
people come in and their applications approved, they're able to take the tests like within a short period of time. So the list is always.
Oh, great.
adjusted, Which
Okay,
is nice. Otherwise, provisional appointments, you gotta wait. and all that good stuff.
okay. All right, great. That's good news then. All right, we have a motion and a second. All in favor of filling the 3 full-time caseworker positions? Aye. Okay, thank you. No one's opposed. The last is the authorization to fill the administrative assistant position at the Cayuga County Mental Health Center due to an upcoming retirement.
Yeah, Liz Twinsky, 39 years. She started working at the department when she was 18 years old. She pretty much runs it, so she's retiring, and this is a resolution to replace her and then do a fill behind. I think we're gonna promote from it, then it looks like. It's a budgeted position. It's really important to the department.
I don't know if when I looked, there was no authorization to fill as part of this. Maybe it hadn't gotten through the HR approval yet, but this is a non-bargaining position. And the detail of what grade this person is and the starting salary were all part of the authorization to fill. So currently reads, it's a permanent full-time position with a minimum salary of $53,400. So I question Ray, where were the details, but I did get a copy of the authorization to fill, so. All in favor of this? Yep. Right, you want to say something to it? first?
I would say that you, and the committee are looking at, I mean, this is a large portion of our budget. 3/4 of our budget is mental health
ESS?
and DSS,
Mhm.
and we're looking to go back to the old system where we had two hats.
That would, the upcoming local law in September, what will be that the rescinding of the current law that's in effect and the discussion around going back to two separate directors, one for DSS and one for mental health.
Are these hires gonna interfere with any of that? That was my question.
Yes, no,
Well,
this
that's
was,
good.
yes. Okay. Any, all in favor?
We need a motion. We need a motion and a second first.
Oh, I thought we did
I
that.
thought we did that.
Yeah, I did too.
Trish did, or Timmy seconded it.
Who was it? I'm sorry.
Trish and Tim.
Trish and-
It's hard with the mask. I read lips.
All right, I think that wraps up the approval of the resolutions. If we want to go into department reports, certainly can do that. Brenda, you didn't have any resolutions, but is there anything you want to add to your report?
We'll just add in addition to what's on there, that we are in the process of, I just got the architect's drawing just this morning for the Royal Center space. So hopefully we'll be getting a cost estimate shortly, and then can perhaps move forward on that. They worked really hard to accommodate our space needs and make the space HIPAA compliant, handicap accessible, to make it, so our staff are not doubled up any longer in their offices, so that we have the confidentiality we need for client services. And then I also just wanted to mention, we are just putting together, instead of having our senior fair this year out at the mall, we put together a virtual program of speakers for the middle of September. Everything from technology in the home to remaining safe and independent, to power of attorneys, healthcare proxies, our annual public hearing that we're required to have, and scam prevention, because we know scams are a huge problem with the elderly right now. So we have a really good speaker from Rochester who's going to talk about what's happening currently with scams and what to be aware of. So that's just a little bit in addition to what I had already submitted.
And just to refresh myself and everyone, these architectural drawings that we're waiting for would be what we would need to look at the cost of expanding the office space at the Boyle Center, getting people out of the basement of the county office building and centralizing their staff over there.
Yeah, so we'd all plan on being in one building. That's what we-
So long-term care office on the basement would stay, and the rest of the staff would be on the second floor. So all of OFA potentially would be over there and out of the basement.
I think it's at least double the space we have right now.
We're already paying reasonable rent for the basement. This would just be for the second floor.
Right, and it's because it's an HUD building, and the rent is extremely reasonable, well below market rate.
And you anticipate that being the case for the second floor as well.
Right now, the federal government is looking at passing certain infrastructure monies. Are we entitled to maybe make renovations with some of that money?
I have been in discussion with Lynn about this, so she's aware, she's waiting for the cost estimates, and then we'll look at that possibility, whatever possibility.
To see if some of that money could be used to offset the cost. Is that,
Look into any possibility.
So glad
well, I'm not saying anything. I didn't know, okay. Okay, thanks.
And Thursday,
We
The
have a
picnic.
volunteer picnic on Thursday to celebrate. We have over 60 volunteers and 4 senior citizens of the year honorees that are going to be attending our picnic on Thursday out in the open air. So we're safe as we possibly can be. But it was due. It was
We-
time. Started out here.
we couldn't run this county without our volunteers. Scat van, all that. We should do whatever we can to foster some good work.
Support that, thank you.
And, you know, not to prolong the discussion, but I think we had a very interesting discussion at the Office for the Aging Advisory about the challenges of the ISEP program. And the fact that we have expanded in-home services for the elderly, money coming in, but there is basically extremely limited access of hands-on care aids for people who don't quite qualify for Medicaid, but are not well off enough to, you know, it would be my financial hardship to hire their own staff. So the Office for the Aging has had this funding for this ISEP program forever, and the challenges of getting a aid into a consumer's home that qualifies and giving them bathing, dressing, and real hands-on care has become almost impossible. And ISEP has really was the program that was intended to support families so that they did not have to go into a higher level of care, because we could support them and their families in getting some of their care needs met. So, you know, there has been talk of enhancing the aid rate. There's been talk of working with our licensed home care agencies. All of the things that you're talking about have not really panned out. And, you know, so at some point, I don't know whether, and I'm certainly not introducing this, but whether the county would have to consider potentially employing some of those aides using that ISEP funds so that we would have access to care. But you can't expect people to stay home and be supported if you cannot bring the care to their house. And it's not a matter of we don't have the money to do it, but we don't have the bodies that are willing to go out and provide aid service to people. So that's going to be a lot more ongoing discussion, correct?
Remember, yes, it's a huge project.
Okay, thank you. Kathleen?
So I was glad to, you know, the resolutions gave me a chance to talk about the public health wellness program, which is neat and new and different, something that we'll see how it works. The WIC program doing well. We do have a couple job vacancies that just came up, so more than likely next month we'll be bringing forward some requests to fill lactation care counselor. And we had a qualified nutritionist who resigned. She's moving out of state. We're really taking a few weeks to evaluate whether we should try to find a different job title and then perhaps be able to alter a couple job titles but still stay within our budget. So we're going to mull over and see how it's hard to recruit a nutritionist. But we'll try to do that in the interim of looking at our options, and we'll propose some other ideas to all of you for next month. We are really excited moving forward. I had a chance to see the WIC offices as they are being developed in the new ABC Cayuga play space building, and it's on its way. Doesn't ABC the play space looks fantastic, and they had their kickoff. I think some of you were in attendance to that this past weekend. So they are open for children to make use of. And the big spaces next to it, it still needs its paint and needs it, but we're starting to move in the walls, and it's really different. Very exciting. Harmful algal blooms, they're out there, they're in Wasco Lake, or Cayuga Lake. Don't swim in them, don't drink the water, don't let your pets swim in. I wrote down a few more things related to COVID because it's always a hot topic right now since we are in a pandemic. Our vaccination clinics continue, and we couldn't say enough good things about the support we continue to get from our partners here in the county, because we do need that ongoing. I'm looking at you guys, and I know that some of you have volunteered, right, at our clinic. It's wonderful. Our city support staff that supports along with the fire department are really great. We've done clinics at volunteer firehouses, we've done schools, housing centers, the mall, work sites, weekends, weekdays, north, south, central. So we're trying to be as flexible as we can, offering vaccine in a different way than potentially going to your provider, which some providers have been able to start offering the vaccine. And then pharmacies, of course, are another. And there are the big state sites are tapering down, but that is still available as well. Testing is something that we need to really look at again. I don't know how we're going to do that because it's not something that the health department can support. We simply, well, personnel wise, we won't be able to, right? And then, we have people say, well, we'll give it a try. So we're working with that. And we really need to take a look. We have the permission to fill some part-time nursing positions. I think we can have some further conversation about our part-time nursing positions and how we might recruit and retain some of those part-times.
How many do you have now?
Well, we have the positions. I wouldn't be precise if I told you. We had a number of people who worked doing testing only when we were directly performing the testing, but they were typically second jobs, these people. And so then things got super busy for them in the primary jobs. Our school nurses are really great in that too, and working contact tracing also. And I'm not saying this is our tech, it's the part-time rate is not one that keeps people engaged. So that's something I'm hoping we can have further discussion about.
Just, you mentioned we're having trouble getting people to do the testing, so we're not doing testing.
The health, oh no, there's testing at urgent care centers
Okay,
and at doctor's offices.
okay. I
And-
just want to make sure we're doing.
Yeah, so it exists and we updated on the website where the public sites are for testing. A year ago at this time, the health department was directly performing the testing ourselves.
Right.
And we're not doing that right now.
What about the EMO kind of?
And emergency management did a great job for asymptomatic people. I don't know that the need right now is as much for asymptomatic. And so that kind of leads into the at-home testing. There's some study probably put out.
Buy next now, or people are buying like crazy.
Yes, so that's fine to do it at home. You should not do it if you're symptomatic. It should be more of a, I'm curious, I'm wondering, or my doctor's office can't get to me for another day type thing. We are able as a health department to accept those results. If you keep the card, put your name and your date of birth on it and call us, because we're gonna need a picture of that positive test result in order to incorporate it. It's really, to your point, it's really important to have testing because that is the only way, if you are positive, that you will be able to get your isolation and quarantine papers to have it go through the laboratory system and you get registered. Which is why if you do an at-home, you have to call the health department directly. We definitely are seeing an uptake in cases.
So even though it's not ideal for symptomatic people, if symptomatic people choose to do it and they test positive, which
We will accept it as a positive that it is, and
there's more likely false negatives than there are false positives, is that true?
potentially for the antigen-based testing, yeah. And it's good, we encourage people to go and get the PCR testing if they are symptomatic. Again, it's a more precise test, but also it goes through the electronic clinic lab recording system and it can become part of your medical record, which is a good thing long-term for people to have that, because it's especially if you need treatment or something moving onward, then there's a record of your diagnosis. So far, what do we do so far?
Works that another question.
Yeah.
Just the concerns of testing. Do we have any numbers? How many people are tested? How many, I see the testing results. Do we have numbers that are positive and are negative? We publish that information.
We do not publish that, but to that point, if they go into the system, that's how you get this percentage positivity rate is based on all the tests that are done. So.
Like the percentage of people who get tested that are positive ties right into the county's positivity rate.
Well, I guess my question would be then, let's just say you know, we tested 100 people and 10 people tested positive.
Mhm.
That would give us a 1% or 10%. And we don't know how many people you know.
We do, so, correct. If the testing is done through the labs, which the vast majority are, we can query the number of tests per day and manually count up how many people were tested on any given date.
Because every provider has to put that information into the system they have access to. That's how you,
Yeah, within 24 hours of your testing, that should be uploaded. That's where you've heard me say that certain places are more on top of it than others in uploading that data. Which is why if you do have a positive test, we want to tell people, if you haven't heard from the health department in 24 hours of your positive test results, it could be that your provider wants to inform you first, or the urgent care center that you went to, or, but it's also possible their system's not working correctly, so call us and we'll do double checks and we'll do follow up, and we've certainly done that a number of times for people, to verify their status and then proceed accordingly.
So just be, for my own clarity, we do not publish how many people were actually tested in the county.
If you wanted to know it, I could tell you, but I'm not going to task that of one of my staff.
Okay.
Unless
Just,
if there's.
just out of curiosity.
Also, if there's a COVID app too, you can look at, or it is nailed down our county. So it will tell you the total persons tested on a day and how many of those are positive. So this is like, yeah, it's very.
that's where you get all your data, right?
That's it. The same system goes on that. I don't even know anything about that.
But it's still, yeah, so it's a great, but like, very. like,
Thank you.
So
Wait a minute, Tim, yes.
I mean, the purposes of this whole thing, I mean, you've got to follow the science and, you know, when this thing first occurred, it was flooding the hospitals with a number of patients and is the hospital overwhelmed at this point? I mean, we're testing but are people actually being incubated or hospitalized?
yes,
But I mean, what is the rate of that?
so in today's report that went out, there are 3 Auburn Community Hospital hospitalizations for COVID today.
And the
But we
hospitals-
also know there's one at upstate. We know there's one at Cayuga Medical,
Yeah.
but we don't always have that.
But our hospital system is handling the most critical people in the best manner that you can fight
Our
this.
hospital's working hard to absolutely provide the service for.
We don't have to set up like the Javits Center or anything else to handle an overload.
And no, not today, and I certainly hope not ever.
Right.
Right.
So we're handling the amount of population that's coming down with the illness.
Or they're shipping them out to another place where they can be
And they can,
managed at a higher level of the,
Our network
if that's necessary.
our
But
network
local
of
hospital does
hospitals
a good
are
job.
handling the actual numbers that are coming down.
Correct.
Do you know if their census is 80 some patients, and that's about what at one point the census was there? They are only certified for 99. There are some, you know, they have to have enough staff. I mean, that's, to your point, that's the concern, that there will eventually be more capacity to take care of than the hospital system in the county can handle. And if that happens, what happens to the rest of the patients who have to have a bed there for non-COVID related?
Very
Stuff.
real concern.
And then
That was a real concern last year.
The issue of canceling elective procedures and as all the staff gets diverted to that. Those are the things that isolation and quarantine are supposed to hopefully safeguard against.
Yes.
And the population that this is affecting is senior citizens and people that are overweight are coming down with maybe more severe.
Well, I've got some information right now, but I think you're right. People who have other health related, so by nature of aging, our immunity is not as strong. The older we get, the less of our own immunity that we have. Additionally, chronic illnesses
Well, I
whittle
mean,
away at that. So people, without question, the number of fatalities have primarily been our older population and people with chronic diseases. That does not mean that younger people aren't going into the hospital or getting intubated. They're not dying as much, but everybody's getting sick.
I mean, we just put a new pipeline in the lake to get lower. I mean, the algae bloom, to me, is threatening more people because there's 52,000 people drinking that water. You know, I'm very concerned about that. We're not coming down with not having enough facility to handle the caseload that we have with, you know,
The
virus.
water treatment plant's working well, both of them, for us, so that's good.
And we're thinking about putting a new pipe into Cayuga Lake, which is deeper. But we know that the algae bloom runs up and down as well as lateral. So you can go as deep as you want, it might still be effective.
Right.
So I'm concerned about that being more effective in
I would
public
say
health.
why choose? There's enough public health concern to go around, Tim.
Yeah.
There really is. I
No,
mean,
but I'm saying that
there's.
the
to say
hospital
one
is
is
handling
worse
this
than the other.
crisis. Is that correct?
The hospital is doing a great job serving our constituents, yes.
We're not overwhelmed.
I'm not the best person to ask. You should ask the hospital people that, because
Can
they
you
can
get that-
speak more to their
that
staff.
answer from the minister? We're public health. aren't
Yes, we are. And what, you know, no one has a crystal ball into the future.
No.
This is all about trying to mitigate.
we? Yeah.
Prevent is the key. So, for example, we've had a number of people who've had parties, and that's perfectly fine, right? People can do that. But where we're becoming frustrated as a health department is that people are not being forthcoming about being at these larger gatherings, so that our contact tracing is not as thorough. Now, not everybody is doing that, but very much there was a situation last week where, 50, 60 people got together and they're posting all over social media about it, but not being truthful when they are being asked, who are you in contact with? And we have absolutely had positive cases spring forth from that. I brought, we're going to put together a diagram with one of our daycare centers, just to illustrate that this is my hand-drawn version that I'll pass around to you. We've got a daycare center and the number of people who live there, the number of children, and then the family members from those children, and an offshoot, right, that goes to another preschool, a sibling goes to another preschool / daycare center. And that's Friday.
Yeah.
That was Friday.
This is Tracy.
Those are the positives. Those aren't even the people in quarantine, right? So when the positives come through, but it's a real challenge at times.
Yeah.
Because people get scared, I think, that they're going to be punished or stigmatized. And that's not, this virus, this Delta variant is so contagious.
Right.
It is not a shame to be positive. It's a shame if you don't do what you're supposed to prevent others from getting it.
Can we get you more resources, more personnel to handle so that it's not
That's
overwhelming?
something that we're working at, because we are actually trying to request back some of our tracers who had paired off for the summertime because the numbers went low. So we're going to try to get some more of them back, because we are definitely seeing uptick, which leads me to this piece of paper that I have.
I mean, that 200,000 of the American Rescue Funds going for public health response is the funding that has been made available if you need it. Now you just got to find the bodies, correct?
That's right. We need to find the bodies, and unfortunately, we're very grateful to have that kind of as our resource of last resort, because we do have some different grant funding opportunities that we're trying to utilize fully first before we then go to the local allotment.
I had one question about the daycare, because I saw the letter or the thing in the paper that there were 5 daycare centers or providers, or the oversight for that is the health department. Is that also OCFS? Do you have to report that if it's a certified or registered provider?
We do not have to report
You don't.
that, no, but I wonder how much, the number of these are certified, some are not. That's a good question, Elaine. I'll look into that. I don't know that for sure. We've been speaking with the childcare solutions and that has not come to our attention that we should be doing that.
They do oversight of them.
That's right. Yeah, I'll look into that. I'll see what I can find out.
We want them to open up safely, that's.
Absolutely. I mean, it's, we all need safe places for our children so that we can have our jobs, so we can, work in the community. And it's a big deal. August, we were just seeing a boom, right? We're seeing a boom right now. Through August 8th, so I don't have the final numbers for today. We had at least 20 people we admitted today, but there were some people working this evening, so we'll have the final numbers tomorrow. But as of yesterday, just the first 8 days of August, 66 positive people in our county. Of that, 25 are under age 18, 6 are over age 65. So far more children, and not, which goes to the, and of those under 18, the majority of those under 18 are children who are not eligible for vaccination at this point in time, which again correlates with daycare. So what else do I have for you? Those are kind of the highlights. The delta, the diagram. We're talking with superintendents because school is just around the corner, and how we can work well with them to keep our children in school, which is the goal. We all want our children in school and in classroom, in person, in classroom.
I got a couple of questions. Get off on a little crazy discussion over. Are we currently? I know that there's there's some confusion about some terms out there. The county is not under any mandate to wear masks at this point in time, correct?
There is no state mandate for it. There's the CDC recommendation for it, and our chairman has made a recommendation in public places as well as for personnel.
So recommendation, but not mandate.
That's correct.
And that includes just the
I defer to our chairman for that. Yes.
so it's just a recommendation for inside the building.
Everywhere that has been stated and stated as a recommendation.
And the reason I asked was I had an individual in my district come to me and say, look, I went up to the county office building, go to the motor vehicle department. I came to the front door. I didn't have a mask on. I have both, been fully vaccinated. And they told me I could not come in and go to the unless I had a mask on. So have to have a mask on to come in and go to DMV. So that's not a recommendation, that's a mandate.
Well, you really, that is the
Protocol. I just to address that, because you bring up a good point that people said, oh, I got the shot, so I don't have to do this. We all got the shot, right? So we stopped the virus spread and we're hoping that we wouldn't have to. This summer is not rolling out at all like was anticipated. And this Delta variant is so contagious that we're seeing far more breakthroughs with people who are vaccinated also, who can be carriers, who can get sick. Fortunately, for the most part, the people who have been vaccinated are not getting severely ill, hospitalized and dying. But we definitely in our county have a percentage of breakthrough cases. I want to say about 28% cases. I'm numbers in August.
Understanding that. Something minded here. So I guess what I'm trying to wrap my head around is it's a recommendation that we wear the mask even though you're vaccinated. So when you come to the door and somebody says, no, you cannot come, just wear it. That's not a recommendation, that's a mandate. Am I correct in that term or no?
Your vote on the chair takes the place of the county minister. And county administrator would have the capacity to determine how the facilities would be.
Not disputing that part.
Yeah, I'd have to do a detailed thing to narrow down to exactly what you're saying. That would be general.
Again, I'm trying to understand, I mean, I'm simple-minded here. Fact is that if you come to to go to the DMV, you don't have a choice. You can't go there unless you wear a mask. Is that correct? Am I correct in that?
That is the directive at this point.
So then it's a mandate.
I did not come out with a mandate yet. I will say Onondaga County mandated on Friday. That every county employee and guest go to their county and must wear a mask. That's a mandate.
Well, I
I
guess
put this out that's one day to say. This looks like we're gonna have some trouble here. To err on the side of prevention, we're gonna mask up and
I understand, it's a
Yeah.
recommendation.
Yep.
So recommend wear a mask.
right.
So if somebody comes there, if they say, I don't want to wear one, but I need to go to the DMV, can they come in or not? Because if you say no, to me, you're mandating somebody to say, you can't come in here. You're mandating that they have a mask to go to the DMV.
Is it because they just didn't want to put one on? That's what they got.
The only thing I can say, he came to me and said, look, I've had both my shots. I came to the office, and I need to go to the DMV for something to get done there. The officer stopped him at the door and said, you have to have a mask. He said, well, I've been back. He was told, you cannot come in here unless you have a mask. So I guess my question is not on the mandate, it's a recommendation. He says, no, I don't want to wear a mask for whatever reason. I didn't even give me that information.
Right.
And he was like, they said, no, you have to have a mask. He went outside, went, got a mask and came back in. But, he said, the paper said that your quote was recommended. But he was told when he came here, no, you have to have a mask on to go into that office. So that to me is being mandated. Mandated to if you're gonna use that office, you're being mandated, you have to have a mask on. So that's being mandated. I'm a little simple-minded, that's the way I get it, or the way I understand it, unless I'm completely wrong.
Question. I work in an office, and when we're sitting at our desks, we don't have to wear a mask. If we get up and move around, then we have to have, it's just office policy. It's not countywide or statewide or anything else. So, Mark's question is, when the general public enters this building, do they have to have a mask? Am I reading your question
Yeah,
right?
so that's, I guess, my question, simply, they had to have one in the building.
I don't think we need to, the letter of the law, the spirit of the law, well, what is the law? Is it mandated?
Mandated by, do we have a local law or a local ordinance or anything like that? The answer is no. We haven't gone to that extent. The county did authorize the chair for certain emergency powers and all of that. I would have to look at it because I don't recall if there was a sunset to it. I think that's kind of what you're getting at, right?
Well, I don't want to confuse the general public in regards to if they have to enter this building with a mask, then say it.
Yeah, if it's, you can't come in this building without a mask. If that's your all's choice, fine, and just let everybody know that, hey, you cannot come into the building without a mask. Like, very simple.
For-
And
Understood. Some of what you're saying is, is semantics. What's the difference between a directive and a mandate? But I understand the question, we can get back to it. With that. I mean, we have the announcements that the chair has given that, you know, at least for this building, basically going to that situation. You know, whether that's directive, mandate, whatever, that has set the protocol for the building.
I mean, for our employees.
But have we done local law? No. Have we-
Even if it's just a county policy, the county policy for this building, you cannot come in this building without a mask on. Is that policy? Yes or no?
And for our employees, for our employee protection, I mean, when you enter the building, put a mask on. If you're seated to go to work, can we take the mask off?
Yes, of course.
That's part of our
That's it.
protocol.
Once you're seated at your desk in your workspace, you take your mask off.
It's that layered approach, right? You want to keep our social distance. Don't come to work sick. That is the number one. Don't run errands when you're sick. You have choices to make, and that's kind of what the education that we give to a lot of our positive and quarantined people. You have choices to make, and your choices have consequences though. So please do your best to, you know, again, you want to mitigate this virus, and you want to stop it. So many options. Keep physical distancing, wash your hands, don't go anywhere sick, wear your face
That's
cover,
why,
which is so clearly shown to stop droplet spread.
well, we separated these chairs or these desks so that we could have some distance.
Yeah.
We're trying.
It's good. I'm impressed. I like this layout personally. I can see, oh, yeah. And
But we shouldn't confuse the general public, and that's what Mark is saying.
I'm just,
We either are or we're not.
that, I guess that's my question. Not articulated any simpler than, you know, is there a sign on the door that says you can't come in here without a mask on?
There is.
there is.
And that's for the general public.
Yeah.
It's on the door, front door, at this
The
time.
back says all employees too.
Correct.
The
I
back
get
says
the all
all
employees, I get
employees.
the employees thing, but I'm talking about the general public. So if I wanted to come in here tomorrow, forget the fact that I'm a county employee.
Yep.
If I was just John Q. Public,
Your point is to make it as clear as possible what the rules are.
yeah, because like you said, he, you know, I mean, the article in the paper, you said recommended. He got here, he was told, look, even though you're fully vaccinated, you cannot come in here unless you have a mask.
Right.
To me, that is being mandated. I guess I don't know any other word to put it other than you're mandated to wear a mask to come inside the plane here.
Like, I will tell you that Monday evening, I believe it was really when we really put this together, to say employees can start coming to work with a mask, we need a mask, you know, just like we used to, unless you're in your workspace, and then all guests have been already coming into our buildings with a mask. All that's never changed. Vaccinated or not, it's not, you know, we always wanted that. But we certainly made sure there was signage out front Tuesday morning, and signage all around in the building. Emails went out, press release went out to all the news outlets. You know, it's because we've been through this, right? We've been here. We don't want to go back. This is preventive measures.
I'm not disputing any of that.
After we did it, many, you know, many people were doing it at the same time, like, and then, of course, other counties are doing it. But I will tell you though, in the past 3 weeks, we went from having a full-fledged meeting here with extra people and celebrating the fact that we were all together. Like, I think I was the only one with a mask on in that room. And that was 3 weeks ago. And now we're back to, you know, whoa, let's see what happens. So last week when we met to talk about what we were seeing in the community, that was a first big thing. If we move to a mask mandate, that's another level that.
I guess that there's some confusion out there. I mean, as on the 6th of this month, Congressman Catco says there is no state mandate for masks. Governor Cuomo made the same statement either the day before, I don't remember the exact date. There is no state mandate, we're not under state of emergency. There is no mask mandate. I understand, they recommended, both of them. Recommended throughout public wear a mask. But, it's confusing when they say, it's recommended, and to go into any place, you have to have.
It almost seems like they're leaving it to the businesses to decide for themselves what they want to institute for their own business policy. That's sort of what's happening, right? There's no state mandate, the governor's not saying it, but they're looking to business owners to say, get your own policy.
People have choices and people are gonna choose to go to places not gonna get sick.
But that's the confusion.
I'd like to be able to say, we're gonna do this for 6 months, and if the infection rate is way down, then the masks come off, there's gotta be.
We're really,
I guess where we were
we
weeks
there.
ago. It's just, this
So
has come on so
discouraging. It is.
quick.
It is a surge that is hitting us, and no one anticipated the numbers to that.
Especially for summer.
No, especially for summer, for being outdoors and for having a vaccine available.
Right.
And Delta is being followed by Lambda, which is apparently even worse, far more contagious, far more difficult for people to fight off the effects of it. So
So,
get your vaccine, people, wear your face covers, keep your distance, wash your hands, don't go out in public when you don't feel well.
we're doomed.
No, people can do the right thing, be responsible to your fellow citizens.
We're there.
But certainly if we got to a mandate level, and I had an issue in executive order, that would be another level. Emergency met by a particular threshold that we still trying to determine with this variant, what would that threshold be? And we've seen those numbers just increase every day since last Monday. So, I mean, we're hoping that, I don't know what to say. It's a matter of time. Starving the virus is the only way to stop the spread. Masking, social distancing, not going out with your stick, gotta starve the virus. It's like a book of matches. You peel one off and it can't jump to the next match. That's where we're at. And I don't know, if this community is just fatigued, or I don't know what, you want to turn it into a political argument? I'm not here for it. I'm gonna do what's best for our employees, and for our public. It doesn't matter what I think politically or what I feel might be intrusive. We have almost 800 employees to protect.
Well,
We have
Madam
public-
Chair, I mean, I'm all in favor of public safety and public health. But I don't think we can afford much more of, I don't know what to do. I
Do you
mean,
think Cayuga County is by itself? And
No,
isolated?
no,
I mean, Onondaga County is, they have an actual mandate in place that they put in place Friday. For all visitors to the county, all county employees, and then businesses are saying, please, you need to consider before we make you do an executive order over there. That people say, everyone here needs to mask up in the county. When we issued that recommendation last week, it was because we were like, we're not going to need to make sure we're out in front of this. Because God forbid we don't want.
well, I mean, if this thing is coming as our health director has indicated that there's another variance and another variance, then we should do broadband with the money that we have. And make sure that everybody is available to be contacted in what is the next crisis that's out there. We should be sending our people home to do Zoom before they catch this next two variances that are coming.
And, what I've heard from, public health experts and things is the longer the virus is circulating, the more likely the variants will be, because the virus is being allowed to mutate.
Exactly, the more, the stronger it gets, the deadlier it gets,
Right.
just like all viruses.
Right.
Nasty, so we've got to stop it where we can stop it.
And that's the whole point of herd immunity and getting enough people immunized.
Absolutely, to weaken this virus, so it can't jump, so it cannot, as Amy said, cannot feed, cannot continue. We've got to physically stop it from mutating and jumping to other people, which is the point behind isolation and quarantine also. And physical barriers, physical distancing, there are actual, real tangible things we can do to help prevent this, along with vaccine.
Well, we should put broadband in right away because it looks like we're gonna have to head for cover. So,
I think no one wants to go back. No one does.
I can tell you the biggest fear,
No,
The public health
talking to the
department
people in my
Right.
district, you know, and I have been out about, I went to the last school board meeting. And I can tell you, people are generally concerned about, A, kids not being able to go back to school.
Exactly.
They're seriously concerned about that. And I would be too, because I have 2 grandkids.
Yeah.
I've talked to multiple business owners, and they are seriously worried about, you know, being closed down. And I mean, some of them are not, you know, they're barely hanging on. They can't get people, you know, you know, it's hard for them to get people to come to work. And if, you know, we go into this, you know, I hate to use the word lockdown, but if we go into that type of situation, they know they're not gonna be able to survive. Their livelihoods are going to die.
Right, and I think that's the reason that, you know, we're trying to.
And I'm all about trying to get, you know, public safety, this, that, and whatever. I think the confusion, where I'm confused, is that, you know, you get people, you know, some state, local, you know, officials. They're saying, you know, it's recommended at this point in time. And then when they go in the place, this is an example here. No, you can't come in, it's mandated, you can't come in, it's can't matter. I get it, we have the right to do that, I understand, I'm not disputing that.
Yep.
But it's very confusing, and, you know, and that's what I'm getting, people are upset, they're genuinely scared, and they come to me and say, well, what's going on? Can you tell
What's
me what's going on?
wrong?
And I'm like, look, I read the same COVID updates that you do, you know, I get them, they get them on their phone, I get them on my phone, I get them on the computer, and it's, you know, it's scary. But, and again, I saw a video that says, you know, that the Delta variant is very small and masks don't stop it. I'm not a doctor. I don't know. I'm not a microbiologist. I don't know that either. But, you know, there's arguments on both sides of the fence. What do you believe? I think what everybody's worried about is getting factual information to the public, the general public. And everybody be on the same page. I guess that's what is bothering people. That, you know, every time they turn around, somebody else has got a different story.
Exactly.
right.
I think because this is health, human services, we just listen, you know, this is who we believe our public health director, data of our. And if our numbers are going up, we said 66 in how long period of time? August, right, so far in the 9 days of August. We're in July, we're gonna hit 2, you know, every couple of days, right? That's significant. So we don't want to wait for it to become hundreds of people. We don't want to wait for our hospital to be overwhelmed. We did that this month. We're not going there right now. We're going to try our best to do what we can. Nobody's a microbiologist, but we do know something's happening. So we're going to try to do whatever we can to keep productive in our workplaces, keep our businesses open. You know, masking, you know, is recommended by the CDC, who we have to listen to. We are in a position, I will say, you know, our governor doesn't have executive powers. You know, he doesn't have emergency powers, I should say. Executive powers either, but he doesn't have emergency powers, I should say. So it's up to localities, local governments. And we are guided, you know, at this point by CDC, interpreted by our health department, who then would let me know, to let everyone here know, the governing body to see, you know, what's going on. How serious do we need to make a mandate, or do I need to issue a declaration? We are still operating under state of emergency in Cayuga County. That has never ended because we were able to hold those vaccination clinics and things with personnel, which we require to have in state of emergency. So that still holds. So I guess, for me, I've been taking it day by day to see what's our community experiencing and then what measures do we need to put in place. It's very, and I'm very nervous. I'm very nervous that here it is in the middle of summer, like we said, half of our population is vaccinated. It's nice, people aren't indoors because it's cold, and we have this transmission rate that's very high. That's very frightening. So we gotta do what we can with what's available to us. Maybe we find out that different masks are needed, or, I think, again, we're still putting this plane together midair.
Yep,
It's,
Well, man,
it's very frustrating. I get it, and especially if you own a small business in this climate, to the workforce, and I mean, it's all stacked against us. I mean,
Sure,
real awful.
I'd like to refer another question. I remember back, when it was cold out, wintertime, and, we were going through all this. And they said if you weren't wearing your mask, because, you're in your own home, whatever, they did say, put it out in the sunshine, the UV rays would kill, the COVID-19 virus or, whatever. Is that still true with the Delta version?
I don't know that. I can see what I can find out, but I don't know that.
I mean, we could have a different variant or another major polio, and we don't know what's coming down the pike. But we do know that, to stay alive, we need water. I'd like to be able to say, the water quality should be best it can be. I mean, the variants are gonna change, but we know a constant is gonna be water. If our water systems are shut off anywhere, it's a major disruption in business and everything else. So you've got to be on top of all these things. It's tough. It's tough. So if you need more resources for any of that, we should be able to say to the chair and the rest of the ledge that you need more resources.
I'll keep that in mind.
One last question, and I'm gonna shut up. Tomorrow's briefing in COVID, about COVID here in the chamber. How long is it gonna last? I know it starts at 2, but then like an hour. Or is it-
That Dr. Connor and Nancy Purdy, is that that conversation?
Question and answer, is that what you're talking about, the employees?
That tomorrow? Oh, I don't have the date.
It's,
I'm not thinking
it
11th
says,
and 12th. I think it's the 11th.
Yeah, the 11th.
I believe it's on
Tomorrow's
Wednesday.
10th.
So,
The 11th at 2 p.m. Is that like an hour?
so I came to one on the 3rd, the presentation, but really more, it was about 10 minutes of initial presentation, but then it was questions and so it could have been 20 minutes. There were some really great questions asked by the people who were here that were very relevant and not only, dispelled inaccuracies, but asked some questions that are not simple to answer. So it ended up being 30 to 40 minutes, but it could be as long or as short as the questions that are given. And Dr. Connor, Dr. Barbara Connor, she's fantastic.
Is that going to be available through Zoom?
I know that Thomas Fund is working with us to try and do a recording of it so that it can be shown again. I believe that it is going to try and be live streamed through Zoom at the same time. That's my
Super.
understanding, but I've never been part of that myself.
Madam Chair, if we could come up with a vaccine that when you take it, you'd feel younger and more virile,
I'd say no. I don't know.
why can't we come up with a vaccine like that? Everybody would sign up.
Any other questions for Caitlin? Great,
Good, thank you.
sorry, Ray,
Sorry.
you're on. Is there anything you wanna, no, it's a very good conversation.
It's needed.
I'll just mention a few things for you. So you all saw in the paper, the closing of Evergreen, the adult home in Weedsport. That's a pretty big problem. It's 57 residents. They're all have significant mental health issues. They've been farmed out to a bunch of different adult homes, some of them out of the county, some of them ended up in nursing homes. The Department of Health, we've been trying to have a conversation with them and haven't really had had much luck with that. Would like to talk to them about, but would just like to get some signal from them about whether or not these folks can regain their license, if there's stuff that they can do. That's been a really important place for folks who aren't, no adult home will take them. It came as a, it happened awful quickly, which I understand why it did, but
Are you thinking there's not much hope in the 60-day thing?
I don't know, like, I'd like to hear from them, you know what I mean, like, what needs to get done, is it even possible? Because if it's not, we're gonna have to start thinking about some other sort of strategies for folks.
And the cost of shipping and doing all this, might be easier for us to be of some assistance financially to maybe get them back in the business to handle that population. It's very difficult to handle.
We'll see, I mean, I think if that's part of the conversation, that they need additional resources or supports to be able to manage folks, and then I'll come and let you guys know. I think the rates for those things are awful. I mean, they don't get any money. I mean, they get something like,
Yeah.
I don't even remember, like $11.
$26.
Oh, it's awful. So they're always sort of struggling to try to meet people's needs. But I'm trying to figure out exactly what it was. I don't know if it was a staffing thing. I think it had related to medications and sort of the paperwork that you have to, keep track of and everything like that from regulatory
It's a
perspective.
big
and all
deal
that.
for the state to do that, to relocate.
Yeah, that's a pretty dramatic thing to do. And they moved them all in 4 days, 4 or 5 days, and everybody was moved. We have some people that are gonna be very destabilized by that.
Yep.
So I'll keep you guys posted when we learn more. And so in Christine's report, she talked about, the emergency rental assistance program, 540 applications for Cayuga County have been filed. They still haven't really moved any money to any of the landlords, which is a problem because these folks haven't gotten any money since could be March of 2020 up until now. And now you're gonna start running out, like if you can only go back 12 months, now you've exceeded the 12 months and people are still gonna be at a loss, even if they get that money. There's some provision for like 3 months of additional funding, but that's still only 15. I just was reading the emails over there. We haven't been getting any really good information from OTA about this. We're supposed to sort of know how the application's complete, how much money is involved in each application, what's owed to the landlord and all that, but they're supposed to be talking about some sort of artificial intelligence tool that will be able to manipulate the information to get those answers. See, and then once I can get that information, I'll definitely share that with you, because I imagine people are talking to you guys about, folks living with them that haven't paid their rent in a long time. And all of this
And
sort of stuff.
extended the moratorium here,
Moratorium in New York State ends August 31st.
but except if you have a significant spread, I thought there were some issues around designated areas where it's going to.
So there's
continue.
that's the CDC's,
Mhm.
extension of the moratorium is related to sort of that sort of stuff. I think everybody's wondering if that's going to hold up in court. Because I think there was a court ruling, kind of vague, but said that
This is it.
CDC exceeded its authority in doing that nationally. So I don't know. Who knows? I'd be very concerned. We still sticking around 70, 75 homeless folks, in Cayuga County, really spiking in families. About 20 of them typically are families. The shelters are full, the motels are full. It's tourist season. We're going to be stressed out this weekend if we get a push. If people start getting evicted, not everybody who gets evicted is going to be eligible for emergency housing because people have assets and they have jobs. But this could be a pretty serious thing for the county to have to handle. So we're trying to keep an eye on it. It's hard to know. There isn't any place that you can go to find out how many people are behind on rent and all that sort of stuff. So.
Yes, Trish had a group of people here.
Yeah, we're meeting again next week. So there's this housing visions.
Yeah, my thought was that some of the capacity at Malone Village is offline now because of the renovations.
Yep.
And hopefully that will get back online and maybe.
Move some people around. Yep. And there's some long-term planning around additional affordable housing slots and neighborhood renovations and rehabilitations in the city, like they did on Orchard Street, and how they also did over, what is it here? Not Woodlawn,
Foot Street.
but
Foot Street?
right here behind us.
Oh, Foot's this way.
No, Fort Street comes around Easterly, or whatever it is. They did like 6 or 7 houses there a long time ago. These guys got pretty good track record of being able to get this done, so that's kind of exciting. Also looking at some shelter opportunities still, some properties on that Grand Avenue that happened. Long-term plan.
Orchard Street, yeah.
They did that. Partners with the Allen Foundation and a bunch of other people. So these guys know what they're doing. So Trish put us all together and we're still talking. I mean, both departments are really busy. The APS cases, adult protective service cases are really starting to spike. People, this isolation and what you talked about earlier, that everybody's eligible to get in-home care, but there isn't anybody to do it. So those rates are terrible too. You can't pay people, pretty transient, they don't show up for shifts and stuff like that. So we're concerned about that. We're concerned about, family first beginning and some of the stuff we talked about earlier, and there'll be more talking about that as well. And I'm preparing the departments for transition and everybody's really busy. So happy to answer any questions you guys have about anything.
Wow. Everything's coming down at once.
Kind of always like that, it seems anyhow, but I think that it's been very stressful for staff for this long. You know what I mean? I think this, people were hopeful and now they're not, and that takes a toll on people. It makes it hard for them to, stay focused and stay at work, and you're worried about their families. You're worried about going back to school. There isn't any real good answers. So, I mean, that's, the temperature of the workplace is always something you kind of want to pay attention to. And there's a lot of things out of your control, I think more so now than in the past.
So funding, I mean, the pipeline supposedly has a lot of funding for COVID issues and.
You're gonna see a lot of money
emergency
move.
Housing, and I mean, I think the governor and the senator were fighting over release the monies. Isn't he?
Yeah, there's a lot of money out there that hasn't been released yet, which is kind of troubling. I think that once whatever these sort of roadblocks clear, there's a lot of money coming down for mental health, for public health, social services, addiction stuff. There's a lot of that. It's going to be, I think the next 4 or 5 years are going to be pretty exciting for the work, you know what I mean, and for the funding and the support. I think that we learned a lot of things during this pandemic. One is we don't really take good care of people that need to be taken care of. So I think that's a realization now that is gained some traction, which is good. I think, people should have fairly decent lives and should be safe and should be healthy.
Got to make people go to work. Some go to work.
I don't think that people would argue with you paying them more money. I mean, I sort of go on a limb and say that.
Yeah.
Any other questions for me? All right, thank you guys.
Thanks, Rick.
It's nice to be back in the room.
Yeah.
You know?
I don't know how well.
No, I know, but I think it's like, I mean, I'll just say this, the most important thing is keeping people safe. All the rest of it is time and noise. So, we had staff wearing masks and patients coming in wearing masks, and so we've had some breakthrough cases of mental health now. People, like everybody's vaccinated, there but one person, and we went the whole COVID time without really having anybody in quarantine. Now I got like 12 people who got to be paying attention to whether or not they got to go into quarantine, and they're all vaccinated.
But the evergreen thing is
A mess.
that's, if we can somehow help that crew.
I think they appreciate it.
Yeah.
Thank you. Motion,
Go ahead.
make a motion to adjourn the meeting.
All right. Second?
Whatever you want.
2 seconds.